Hi, this video is the demonstration of the FUT linear scar. Again, the result varies from one individual to another, and I perform both FUE and FUT. Both FUE and FUT produce scar, but the FUT has a linear scar where the FUE leaves tiny dots of scar. Now, some scar can be wider than this, some of them can be more narrow than this, and this depends on a few factors. There's many factors, but the other common factor is genetic. Some people, the body will produce small scar no matter what, while other, the genetic will make a lot. Genetically they produce bigger scar than other. That's genetically the big factor. The other factor is how big the surgery is. If the surgery, 4, 5, 6,000 grafts, the scar tend to be a little bit wider than surgery with like 1,000 grafts. Why? Because with bigger surgery you cut wider, and when you close down, the tension tends to be a little bit more tension, and versus the smaller surgery and you cut more narrow, and then when you close down there's less tension. But again, even that, sometimes genetics will outweigh that and make it worse or better. And then trichophytic, we use it as standard. So the strip, the downside is not just the linear scar, but it's more invasive than FUE, more painful, more bleeding, more chance of infection. But on the benefit of the strip, it's cheaper. You can move large number of grafts per day, 4, 5,000, 6,000 grafts per day. It's very effective for advanced and loss. The strip method is not just cheaper and you move more, but the growth rate, you can have excellent growth rate with FUE and FUT, but you compare my FUT to my FUE, the FUT have better density of 5 to 10% better density. On the other hand, the FUE leave tiny dots of scar, allow you to shave your head shorter. The FUE other benefit are less invasive, less bleeding, less chance of infection, less painful, and you recover faster. But the downside of the FUE, the cost is more expensive. The number of grafts you can do is less, 25 to 3,000 grafts per day, although there are days I can go beyond 3,000. And then the other downside of the FUE is the growth rate. Now, you can have excellent growth rate with the FUE versus FUT with my work. However, and again, I'm a FUE specialist. However, if you compare my FUE to my FUT, is 5 to 10% less density of my FUE compared to my FUT. But my FUE still have better density than any other clinic that does, many other clinic that does FUE or FUT. So this is the demonstration of the FUT linear scar. Result will vary. Some will be stretched wider, some of them more narrow. Thank you.